Now, back in October of last year, I discussed this subject with Professor Basile Landis. Now, if you remember, he is Associate Physician and Head of the Rhinology and Olfactory Unit at the University of Geneva in Switzerland. And since our conversation, much has become clear about the etiology and progression of disease. We now know a lot more about how to manage these patients, but the impact on someone's quality of life can still be quite profound, affecting psychological well-being, physical health, and sense of self. So let's start right at the beginning. Obviously, we've talked a great deal about COVID in the last couple of years. What percentage of patients who get COVID experience smell loss?
Well, there is an enormous variety from studies at the beginning. It goes from 5 to 95%. I mean, this is an enormous difference. But the meta-analysis talk about 70%. 7 out of 10 patients having COVID, at least in the first waves, had some level of loss of smell.
That's really fascinating. So you mentioned earlier that the common cold can cause something like 60% or 60% of those who get the common cold can get smell loss. Is there any way that when you can prevent this when infected by viruses like the common cold virus and indeed by COVID-19?
No, loss of smell, it's a symptom of the disease. Then the only thing that you can do is to prevent the disease itself. And the prevention tasks are the same that for the disease. I mean, wearing masks, keeping the social distances, washing the hands to avoid contamination, to avoid infection. And if you have some symptoms, being isolated at home.
Now, as always, you can find more information about EUFOREA and also register for the EUFOREA meetings on the euphorea.eu website, where you can also sign up to receive the latest news via email. Our Twitter address is @EUFOREA, so make sure you follow us and keep up to date. Until next time, from all of us here, goodbye.